Hi, my name is Dr. Ben Thompson. Welcome to the 5-day video series about Treble Health. As you can see to my side is the logo for my new company, Treble Health. You know, treble, like bass, mids, and treble, the high frequency, high pitch information that's so crucial to those who have hearing loss or tinnitus. I probably don't know you personally, but over the last year and a half, I've had lots of experiences with patients, with individuals who are managing tinnitus and hearing loss. If you go back to the very beginning of my YouTube channel, you will see that I started making videos about tinnitus from my apartment in California. Now, a year and a half later, I'm launching a new company called Treble Health, which is designed to help individuals by providing online consultation for two conditions, tinnitus and hearing loss. This 5-day video series on my YouTube channel is a culmination of the last year and a half of my independent research into what do patients need, what do you want to learn, what is the best technology available to help you, who are the best professionals, what are the best methods. Each video in this 5-part series will focus on a different theme. The theme for this video is the leading innovation in telehealth for tinnitus. What is the best care available for tinnitus? What is the best telehealth care available for tinnitus? Is there a difference between the two? This is something that I've been thinking about long and hard. We've had focus groups for patients who have tinnitus. I've been doing a ton of research into what everyone else is offering, but I don't want to just copy what other people are offering. I want to create models and services that are exactly what you are requesting and what you need based on feedback. The first innovation that I'm very proud of is one-on-one Zoom consultations. As I've learned, those are the most valuable aspect of getting help with tinnitus, is talking to someone who fully understands the tinnitus journey from the audiology aspect, the psychological aspect, and the holistic aspect, bringing it all together. In my opinion, the audiologist is the best fit individual and professional to do this for you. So connecting a doctor, a hearing doctor who understands tinnitus very, very well with extensive training, connecting them with a patient, someone who is trying to figure this out themselves and going online and being bombarded by advertisements and misinformation and confusion. That process, I know, makes tinnitus worse. Through anxiety, insomnia, and stress, tinnitus gets worse through that process. Being able to have that one-on-one Zoom consultation with a professional is a game changer. What we've seen is usually it's best when it's completed in intervals, either monthly or bi-weekly, usually between a period of 3 to 6 months. Sometimes shorter, sometimes longer. It varies by the individual. Overall, that one-on-one Zoom consultation is, in my opinion, the most valuable aspect of innovation in tinnitus, of what is needed. And what I learned is it happens very easily via Zoom video. Most of what we're doing can completely 100% be done to best practices on Zoom video. There are certain technical things that do have to happen in person, whether you're getting certain adjustments to technology like hearing aids, or you're getting certain comprehensive hearing tests done at a clinic, or you're getting an evaluation done by an ear, nose, throat physician. Absolutely, those have a place. But the majority of the tinnitus retraining is completely able to be done via telehealth. And that's something that our patients can vouch for. The second big innovation is mobile text chat with your doctor. If you're going through tinnitus, you know how tough it can be day to day, hour to hour, especially in that beginning phase, what we call the urgent care phase. And what we know is that when you have a professional who can help you through the process day by day, week by week, it makes the process easier, and it usually shortens the amount of time someone's dealing with high anxiety, insomnia, and stress. Now, it wouldn't be cost effective for a patient to have one-on-one video consultations with their doctor every day. So fortunately, modern technology has text support. Text messaging with your doctor through secure systems is available, and that is the second big innovation I want to talk about. Had to think here, had to research into other fields. We look at psychology, psychiatry, different text apps that utilize therapists with patients who are dealing with stress, insomnia, anxiety. And a lot of the new technology, the new offerings is text messaging support. I've been using this now, and my patients like it because whenever they have a question, they can message me, I can message them back, we can have a dialogue back and forth. So what we're doing with Treble Health is in our tinnitus programs, we are offering asynchronous, it's called text support, where we have a reply from the doctor within 24 hours or 1 business day. This is great because it's proactive. It tries to address problems before they bubble up. And it's the second innovation I want to talk about. The third valuable aspect of telehealth and what we're providing is group Zoom calls with other patients who are going through our process, going through tinnitus retraining therapy, working with a professional, working with one of our doctors to manage tinnitus. And no matter where they are in the journey, from this is the first month I've had it to I've had this for years and I want to make gains and improvements with it, we have a monthly group session so that each individual can learn from others, can share their story, can hear other people, learn from them, and be heard by sharing what they're going through. Oftentimes, you leave those meetings with new tips, new techniques, new apps, new technologies. You relate to someone else's story. Most people do enjoy the monthly group meetings. Now they're optional because that's not for everyone. And we know when you put a group of people who are dealing with something very challenging, it can become a doom and gloom type room or type meeting. But we are monitoring and hosting those Zoom meetings with a lot of attention to positivity, show and share what's worked for you, what's working for others. We're not here to talk about the negative because that's best done in a one-on-one setting via the Zoom video sessions and then the text support, whereas the positivity is best shared in the group setting. You guys still with me? I want to say thank you. Thanks for watching this video. Thanks for learning about what I've been putting my energy into, because creating a new business offering takes a lot of time. It takes a lot of attention. I want to create something that's helpful. We've had numerous focus groups of patients with tinnitus who are talking to me, who are working through what do they need, what can we provide that perfect match and have a business from it. And that's essentially where the Treble Health company came from. So during that process, we realized that having a monthly plan with a doctor and a patient is a great approach to this. Managing tinnitus takes time. It's rare to have things change in a matter of weeks. We're usually speaking in a matter of months. And from my experience, having 3 to 6 months of working with a doctor is usually the sweet spot. Sometimes patients need more, sometimes patients need less. So we offer monthly subscription or monthly rates where you get to see a doctor either once a month or twice a month every 2 weeks. Included in that is the text support as well as an option to join the monthly group call. So that's our innovative approach and we're happy to share it. One last thing here that we gain from our focus groups and my experience is that sometimes patients are in what we call an urgent care phase. Maybe you've been there. When you first develop sudden tinnitus, it's loud, it's obtrusive, you can't sleep, you're having a hard time focusing, paying attention, you're wondering, how am I going to live like this? You might have taken time off of work, you might be freaking out. That's called the urgent care phase. And that's when you need consistent check-ins with a doctor, as well as potentially a therapist, a psychologist, or a psychiatrist, because getting your sleep improved, that's super important. For those patients who are in that urgent care phase who come through our system, we want to give them exactly what they need to keep them healthy and reduce their suffering. So we're going to offer typically meeting weekly for 30 minutes with text support in the interval time. And that's going to be what they need to get them through that urgent care phase, to have it happen as short of a time as possible. That's a really tough place to be in. And we recognize that for most people who develop sudden onset loud tinnitus, there is that period of time where sleep struggles, anxiety is high. And for that reason, we're creating that urgent care phase. So if you're in that, or if you've been in that, you know what it's like, you can reach out to us. We have an option for that as well. So as you can see here, Treble Health offers much more than your average clinic or your average doctor who says they specialize in tinnitus. As you probably know, the average doctor doesn't know so much about the nuances of tinnitus. A good tinnitus audiologist at a clinic will know some of these techniques, but they're mainly offering hearing aids. What we offer at Treble Health is what we found our patients need, a full comprehensive approach to managing tinnitus, not just hearing aids, not just an ENT consultation who says there's nothing you can do, but a full spectrum individualized plan for how will you improve tinnitus, how will you potentially reduce tinnitus. That's what we strive for. We are unbiased. We are professionals who understand the whole market of technology, understand the different approaches. We use the approaches that are the most evidence-based and science-backed. That's the ethos of this company. As you can tell, it's coming from a good place. It's coming from my heart. I've been putting a lot of energy and time into it. I'm hoping that this message lands well with you or anyone else who is considering getting help for tinnitus. Please do find us at treblehealth.com. And thank you for watching day 1 of this 5-day series of introducing our new brand, Treble Health. For those of you who have followed us for a while, you may be familiar with Pure Tinnitus. That was the first project that I launched about 1.5 years ago. And now Pure Tinnitus is part of Treble Health. You can think of Pure Tinnitus as the tinnitus branch of Treble Health. We're going to focus on telehealth services for hearing and for tinnitus. So of course they're related, but they're quite different. The average experience someone goes through for tinnitus is much different experience than someone who has hearing loss and they're looking for help understanding people around them with their hearing. We're going to specialize on both in this 5-part series, inviting you to come learn from me, Dr. Ben Thompson, your host. I founded Treble Health. I hope you enjoyed this video. Thank you so much, and I'll see you soon here on my YouTube channel. Goodbye.